Welcome to everyone that's joining us today. We'll just give attendees a few more minutes to join the webinar and then we will kick off proceedings. Well, welcome everyone to our Pledge With Us webinar series, which we're launching today. I'm delighted that we're joined by BHP and Unilever, who are going to be talking about how they've built an action plan for their own organisation on workplace mental health. But before I hand over, I just wanted to say a few words about the collaboration and set the context for today's conversation. So as many of you may know, if you're subscribers or indeed a pledge signatory of ours already, we're a business-led collaboration with two aims. The first is around advocating for all business leaders to prioritise the topic of workplace mental health, but also importantly, accelerating that progress through the sharing of good practice, knowledge and insight. We're made up of 9 multinational companies with offices across the world, and we have 3 main approaches to the collaboration. Obviously, as our name discusses, this is a platform to connect all business leaders and experts across the world to look at how we can improve mental health in the workplace, but also importantly, tackle the stigma that often acts as a barrier to individuals speaking up and seeking help for their mental health. The second area is around raising the importance of the topic of workplace mental health. This isn't a sort of given everywhere in the world. There's still an argument to be made around the importance of prioritising this for businesses. Not just because it's the right thing to do for the individual, but actually there's evidence out there that shows that actually there's a return on investment for organisations, and we'll be talking about some of that today, no doubt. But today's topic actually is all around our third approach, which is about facilitating the adoption of good practice. And we as an organisation are doing this through webinars like today, spotlight interviews on our website, and also in the longer term, looking at how we can build out a roadmap for change, which can formalise some of this knowledge and advice, and also signpost tools that can help organisations on their workplace mental health journey. So as you may have seen on our website, or indeed maybe a signatory of our pledge, we launched this at the end of January when we launched the collaboration. The idea behind this is to encourage business leaders to make that public commitment and also to signal that commitment to their own organisation internally. It was developed alongside a group of experts and takes a lot of the learnings from different frameworks and pledges across the world. But the difference with our pledge is that we have tried to elevate this to a level which means that any organisation, no matter where they are on their journey and no matter where they are in the world, can use this frame to help guide their own workplace mental health strategy internally. Our Pledge with Us webinar series, which we launched today, will begin with pledge area number 1 about how to develop and deliver an action plan. But we will be following these quickly, covering the different pledge areas that you see on the screen here, and our next session will be in September on eliminating stigma. So without further ado, I am going to hand over to our presenters. We have an opportunity for questions at the end, and I would also encourage you through the presentations to note any questions in the chat, and what I shall do at the end is field those and group them for our presenters today. So I will first hand over to Dr. Rob McDonald from BHP, and then we can, after Rob's finished his presentation, we'll hand over to Tim Munden at Unilever as well. Thank you very much.
Great, thanks, Rebecca. We'll just swap screens and we'll be away. So I just want to check, Rebecca, that you can see my screen. Okay, you're on mute, Rebecca. Can you just confirm that that's all coming through?
Yeah, we can see your screen.
Great. Okay, super. Thank you very much. I'm more familiar with WebEx and Zoom, and every time there's sort of an online meeting with a new platform, I'm sort of slightly nervous, particularly with the audience that we've got here. So glad it's all panning out. So look, thanks Rebecca for the introduction, and thank you to all the founding members for their commitment and support to make GBC a reality. And to all of you out there, thank you for making time to listen to Tim and me. I'm hoping we can provide a couple of insights from our own personal and company experiences that you can take away. Workplaces that support good mental health have never been more important. And it's not just about supporting individual or personal mental health. It's about the work environment, the design of work, the right people in the right roles, levels of autonomy, demands matching available resources, with opportunity for growth, as well as relationships and social connection. When you have all of this, it's incredibly protective of mental health. And in its absence, not only are those that bring personal mental health issues to the workplace more vulnerable, but it contributes to poorer mental health outcomes across the board. And COVID-19 has disrupted many of the core ingredients of what good work is all about, removing that protective buffer for many, which simply compounds the impact of COVID-19 with all of its disruptions and personal loss has on mental health. And we are facing a mental health crisis, particularly in young people. So your leadership now in seeking to create a workplace supportive of better mental health is critical. So in terms of who we are at BHP, we've got a global workforce of more than 80,000 people, and for more than 130 years, we've been producing the resources that have supported economic growth and made countless lives better around the world. Everything we produce, including iron ore, coal, petroleum, copper and nickel, helps to deliver these outcomes. But the production of resources is not in itself what this is about. It's the resources that enable the real difference, driving growth and development, underpinning materials, sanitation and healthcare, sustainable food production, developing industry, building vital infrastructure, and allowing broad-based wealth creation. And as our purpose says, we exist to bring people and resources together to build a better world. People are at the heart of our values, and supporting their mental health is absolutely a company priority. However, mental health has not always been front of mind. 10 years ago when I joined the company, and apart from some localised ad hoc campaigns and most people having access to EAP, mental health was seen more as a personal issue and not something that required focus and prioritisation from a company perspective. In fact, when I commenced, I'd recently proposed a mental health strategy for my former company and was keen to understand what mental health programs were in place at BHP. Recognising the lack of an overarching strategy, I enthusiastically proposed its development. However, there was little support. I soon realised that such a short tenure in the company, I needed to take the time to understand the current company priorities, deliver some results to establish my credibility, and over time, identify some leaders in the business that could support me in championing mental health as a priority before revisiting. It wasn't until several years later that conditions were right to revisit mental health as a company priority, when I was approached by one of the business leaders following the tragic loss of one of our employees to suicide. This leader, long-standing in the business and highly regarded, had also lost an uncle that died by suicide. He was very committed to understand what more we could be doing to better support the mental health of our employees. I had my champion. BHP back then was a larger, more geographically and culturally diverse company than it is today, and levels of mental health awareness varied significantly. There was a need for many conversations involving myself and this business leader across many parts and levels of the organisation to raise awareness of this issue and the largely hidden impact it was having. Not surprisingly, many people we engaged with spoke of family members or friends that had personally been impacted by a mental health issue, and so they could gain an understanding of why this could be important to the company. Though at that stage, very few at the time spoke of any personal mental health conditions themselves. Stigma was certainly right. Making the connection to the role of the workplace really was what the challenge was all about. So critical to successfully taking this forward was to demonstrate the alignment and ability to leverage existing programs and routines, and importantly, highlight that our support for a mentally healthy workforce would support an acceleration towards our desired inclusive culture of care. We obtained sponsorship from Group HSC's member of the Executive Leadership Committee to form a working group. And we identified representatives from all functions of the business, including human resources, health, safety and environment, communications and people leaders from across the globe. We also sought out individuals who were willing to share their lived experience of mental health to provide their insights, support breaking down stigma within our working group and provide feedback on direction. We decided to engage with external experts to find the most suitable framework for us to look to implement, and selected the University of Newcastle, who have done extensive engagement and research on the mining sector to work with. In the end, we adopted their blueprint for better mental health, focusing on the 4 pillars of culture, capacity, prevention and recovery. With the engagement and sponsorship that we'd gained to form the working group to develop our framework, our next step was to seek the endorsement of the framework from our CEO and the executive leadership team. Not only did we gain their endorsement, the implementation of the mental health framework became one of the top business priorities, included in the CEO letter of intent that informs business planning, and only calls out a dozen or so specific and deliverable objectives covering the areas of safety, culture and productivity. The specific implementation of mental health programs is linked to executive remuneration, further strengthening the commitment to the programs. Although recognising the importance of all 4 pillars, our focus initially was very much on the culture space, in raising awareness and reducing stigma, and in the recovery space, strengthening the services and accessibility of our employee assistance program. The risk we wanted to counter was raising awareness, encouraging people to recognise and respond to poor mental health, but then not have access to the supports they needed themselves. We established a global minimum standard for EAP that included a minimum of 6 sessions for each specific issue of concern per year, and the ability to extend where needed. Access for immediate family members was ensured, and minimum provider qualifications were included in tenders. To break down stigma, we quickly realised the power of personal storytelling. This started with the inclusion of workers with a lived experience of a mental health disorder, meeting with and talking to their experience with the Global Mental Health Working Group. It was very apparent, though, that although these stories resonated, the very vast majority of our leaders, when engaged, would refer to others they knew who had experienced a mental health condition. No one was talking about themselves. In order to help break down stigma in the company, I needed to break down the stigma that I held myself. At the age of 26, and working as a medical registrar in a busy hospital, I developed a depressive illness with anxiety. Work became increasingly difficult for me. However, my self-stigma stopped me from ever talking of my experience, let alone seeking support. I ended up quitting my job, took some time out for a while, and then sought out a much lower stress role. I developed several subsequent depressive events and did seek the professional support I needed, developed ongoing supporting routines, but never talked of my experience to anyone other than my wife. It was time to do so, and started talking with my personal experience to our working group, other leaders and teams. It was a real challenge to do so, and I remain uncomfortable still to this day, but also realise the importance of doing so. And with doing so, really became a degree of authenticity in my leadership that previously was missing. Our first global awareness campaign involved filming a number of people from across the globe, telling their personal stories on an experience of a mental health condition, framed in hope and recovery. And this was very successful. This is a pretty busy slide, and getting the detail may be difficult, and it will be sort of shared with you afterwards. But on the slide, which is now a number of years ago, that we developed a number of years ago, we set out what we thought at the time were the priorities for the business in terms of the various stages that you might go through in terms of implementation, the resources that were needed, and called out the types of behaviours we expect to see early in a business's mental health maturity and how those behaviours would ideally evolve over time. Our executive key performance indicators were tied to demonstrating progress up the maturity curve. If we were to have our time again, there's probably one key element that I would definitely change and prioritise earlier on in our journey. In the proactive phase, you can sort of see there's one called workplace mental health risks being identified and managed. Some of you may recognise this as workplace psychosocial risks, and definitely this would receive a high level of prioritisation if I had my time again. It's not to say that these are going unrecognised and unmanaged. There's much that we're doing around psychosocial risks. It's just that we're not as systematic and joined up as it needs to be, and there are improvements needed in the overarching governance and metrics associated with psychosocial risk management. Within BHP right now, the management of psychosocial risks are our highest priority, and I note that this is becoming a stronger focus from a regulatory perspective, at least from an Australian context. In the continuous improvement space, we call that worker resilience. 4 years ago, there was a very strong desire from the business to create a program to equip our people to be more resilient. And so in partnership with an expert group, we developed our peer-led resilience program, which has been very well received, with thousands of our frontline workers as well as functional staff having gone through the program. And the skills learned particularly valuable through COVID-19. So this is one program that is now firmly entrenched across the business. Our other focal point where we need to improve is in the area of monitoring and evaluation. We've been reasonably good at capturing activity-based metrics, but not so strong on effectiveness metrics. I thought I'd finish with sharing what I consider to be our key challenges and lessons. The first one is find your champions. Whether you're a standalone company or a multinational company, don't feel you need to tackle this on your own. Even if you have a team to support you, there will be people out there in the business with a passion for mental health and ability to connect and influence people that, given the chance, will be far more impactful in creating the case for a mentally healthy workplace than the very best business case. It takes a team, and when forming a team, involve one with a cross-section of the workforce in terms of departments, levels and experience, including those who may be somewhat sceptical read this topic. Diversity certainly helps. And where possible, look to include workers with a lived experience of a mental health condition to help break down that stigma and review and advise on your program elements. Match ambition with the resources and the business readiness. I shared that my first attempt at engaging with a business on mental health fell completely flat. The business was not ready and I wasn't resourced with both the business context and credibility to take this on. The next time I was much better prepared, I understood the business, I established credibility, and importantly, with the help of my champion, the business became ready. We were therefore able to take this on from a whole of company perspective, outlining what we had identified as a complete strategy. But it's okay to start small, and starting small can be as simple as starting a conversation, and a conversation can become a groundswell, and from there, you can start to be more ambitious. Changing culture starts with me. Leaders shape culture and culture drives performance. All of us here are leaders, whether that is recognising your title or through your passion and commitment to better mental health. I, for a while, was talking the talk about the importance of stigma reduction and looking to others to lead the way. As uncomfortable as I was, I needed to lead into these conversations. Sharing my own personal experience of mental illness continues to be a challenge. It's getting easier, but I know by doing so, it makes it that little bit easier for the next person to ask for help or share their own experience. And bit by bit, the culture does change. You may not personally have experienced a mental health condition, but every one of you will have experienced the impact from someone who does. What will be your authentic experience that you will share? Very much linked to the above, create the space, be authentic, and people want to listen, to learn, and to share. Early on, I was surprised at the feedback from the success of some of our mental health roadshows at our sites, where we would hold mental health awareness sessions and enable people to share personal stories. The rooms will be full of mostly males in their orange fluoro shirts, listening and responding and sharing and agreeing to take action. Most people will engage, but many also need the permission to do so. Recognise that we are all the same and at the same time different. Although globally we all share a common experience of mental illness, our cultures in which these illnesses occur and the language used to describe these experiences are different. Our global approach has been too Australian-centric. In Australia, there are high levels of awareness for a number of years of excellent public health programs. Chile is quite different. There is much lower mental health literacy, stigma is higher, and the culture is very different, and we have not been as impactful. However, that is now starting to change with greater localisation of approach and increasing leadership awareness. We are definitely making an impact. But even if you're not a multinational company, there will be subcultures and differing levels of maturity, even within a single operation. Seek to understand these, and where possible, think how slight differences in approach may be required for maximal impact. And the importance of good work. Finally, it is where I started that I will finish. The importance of good work. Good work that is inclusive, where demands are matched with resources, there is decision-making latitude, supportive leaders and teammates with the ability to connect, to develop, and to grow. This is incredibly protective and provides a buffer for those individuals that are experiencing a mental illness. Every company must have a good work component of their mental health action plan. Thank you, and back to you, Rebecca.
Thank you very much, Rob. That was great. And questions have started to come in already, but what we're going to do is we're going to hand straight over to Tim for his presentation now, and then we can spend about 20-25 minutes on questions at the end. Over to you, Tim.
Very good. I hope the charts are coming up now. Perfect. Hi everybody, so my name is Tim Munden. I'm the Chief Learning Officer at Unilever, and also I lead on employee wellbeing. I'm going to share with you our approach to action planning on mental health, and you will notice some remarkable similarities to what Rob's just described, which is completely accidental, or maybe these are what companies have learned in the process of creating good action plans. Let me tell you a little bit of context for us, because it's quite relevant to the story I'm going to tell you about mental health. Unilever is a purpose-driven business. Our purpose is to make sustainable living commonplace. That purpose is also based and anchored in 3 beliefs: that brands with purpose grow, that companies with purpose last, and that people with purpose thrive. Our strategy, some of the key strategic choices that we've made include, as you'll see in the second choice, improving people's health, confidence, and well-being through our brands, through how we serve our consumers every day. We also are a business based on a clear multi-stakeholder model, a commitment to a multi-stakeholder model. And of course, included in that are our people. So if you take those 3 anchor points, a purpose-driven company around making sustainable living commonplace, one that's committed to improving people's health and well-being, and that has clearly identified our people as one of our many stakeholders, then the fact that we are very, very focused on our own people's health and well-being, and in particular their mental health and well-being, is not a surprise. It's an inherent part of who we are as a business. So how have we gone about building our approach to supporting mental health in the workplace? Well, we evolved a planning process, a way of thinking about mental health very early on, which we built in our UK business to begin with, but then we've scaled globally. And basically what that focuses on is 4 things: that we're seeking to address culture, So that's about stigma, about making sure we place mental health on a par with physical health. We're trying to really build leadership capability. So that's about the awareness and knowledge on mental health, but also, as Rob's talked about, encouraging role modeling. And this is leadership at all levels, senior leaders, but also the critical role of line managers. We're focused on prevention. How can we help people to have good mental health? How can we prevent the experience of poor mental health where that's possible? How can we build resilience? And lastly, support. How do we give support to people when they start to struggle with their mental health? How do we do that? We do that through enablement through global tools. We do it through communications campaigns. And more recently, we've been doing it through enabling the Unilever community to take care of each other. We have 149,000 people around the world. And I think one of the big insights we've had over recent years is how powerful it is when we equip the community itself. So what are the kinds of things that we do in this 4-box model? Well, for culture, is some of the things you would expect. So World Mental Health Day, October the 10th every year, is a big moment globally. And we spend a lot of time planning what theme we're going to use, how that theme is going to turn into action, and how we're going to support and enable that action to be enduring. We create ongoing podcasts and events, and this is about how you really keep the message current, keep people thinking about it. But there are also critical moments that matter, and we're experiencing some at the moment. COVID's created a lot of moments that matter for mental health. So, for example, in some countries, people who've been working at home are returning to workplaces. In other places, people are continuing to work at home who used to work in offices. But we've had tens of thousands of people who've stayed in their workplaces because what they're doing is critical, for example, in manufacturing of products for cleaning homes and cleaning hands. And we've needed to have people continuing to work in those factories. So, but all of those situations create a moment that matter that we can enable with good content, good training, good awareness to be an impactful moment around mental health. What do we do in leadership? We've done a lot in this area. So classic line management training and capability building, but also trying to look after line managers, support line managers across the whole range of environments that we have them. We have line managers managing people in the field, in sales. We have line managers in factories, in research labs, as well as in our offices. So helping those line managers in the environment that they're in, but also equipping line managers with tools that they can use. I'm going to show you one of those later. Tools that they can use to easily start conversations or to spot signs on mental health. On prevention, there's quite a number of things. So we've trained a cohort of mental health champions. I'm going to come back to that later. And that equipping of the community has been very powerful. Team energy assessments I have to say, one of the things that the team has created that I am most impressed by and proud of. The team energy assessment was built with an external partner. It's a completely anonymous survey that an individual can do. They get a report back. If they're in a team of 6 people or more, the line manager gets a collective anonymous survey. And that provides, again, a stimulus to a conversation in the team about their energy and about their well-being. And again, helps the team and the line manager to talk together and to take action together to create a really healthy team. We've been training mindfulness champions and providing mindfulness materials throughout the organization. And I'll come back to that a little bit as well. One of our brands called Clear, some of you around the world may be familiar with it, has as its brand's purpose helping people with resilience. And they created a few years ago a pathway publicly available on resilience, created by external experts, which we've helped to spread around the organization. And lastly, there's been a lot of employee mental health training, including, as we've gone through COVID, evolving new content to deal with the situation we're in. For example, building understanding of post-traumatic stress, of grief and bereavement, and some of the mental ill health symptoms that have been coming through in the wake of the pandemic. So this is a very live way of building a mental health campaign. And lastly, in support, we've put an employee assistance program into every country we operate. We operate in over 108 countries. I have to say, I was really, really grateful that we'd done that before the pandemic hit, because it meant we had a safety net in place. The mental health champions, of course, also have a really key role in supporting people when they struggle. And I've talked a bit about the bereavement and post-traumatic stress disorder support we've been putting in place. And we also have a global hub with contacts and resources in. So we think constantly about those 4 boxes. How are we changing the culture? How are we equipping leaders? How are we preventing, as far as we can, mental ill health? And how do we support people when they struggle? Now, as Rob said, we've also thought through, as we started this process, the order in which you do things. I think it's really, really important before we start to ask people to feel safe to share their mental health situation with a line manager, that there is support in place for them so that we can actually signpost people to help. I think otherwise that's probably not a responsible thing to do. I think you also have to try and make sure that your line managers or your HR contact points are also trained and ready. So there is an order, I think, in which to start to do things, to start to build leadership support at the top level, and then start to train line managers in what they need to be aware of, to put the support in place for people to refer to, and then to start to communicate about the culture change. And then you can build from there. Sorry, there's one other thing I wanted to say. Sometimes, and I suppose it's inevitable when kind of large companies like Unilever come and talk, it's possible to think, well, if you haven't got lots of resources and lots of money, you can't do this. And I just want to challenge that a little bit. It is amazing how much you can do with very little. What are the best ways of doing a lot with a little? Well, first off, going to find free access resources in the country or in the language that you can use. So, for example, I'm based in the UK. The UK is very lucky to have the Mental Health at Work website, which is curated by Mind, which is a nationally renowned charity, but on behalf of many other mental health charities as well. Organisations have been donating their content to that website. So it's possible to get an amazing amount of curated free resource. Those kind of resource centres exist in different places around the world. That's an asset to definitely go hunting for. Curated by people you respect and people who've got good reputation and free to use. So that's the first thing. There are free to use resources. Second thing, some of the moments you can create don't have to cost a lot of money. I'm going to show you one in a bit, which is a template for how to have a mental health check-in, which doesn't necessarily cost very much. A lot of countries, not all sadly, have public mental health services that you can signpost people to. You don't have to pay for an EAP yourself necessarily. So there are a number of things you can do to get started, which don't have to cost a lot of money, and creating events of people who talk about their lived experience, again, doesn't have to cost. So I think there's a way of doing this to suit many budgets, and certainly I think using free resources is a great place to start. Let me talk a little bit about empowering the community. This is something that honestly I came to a little bit late in realizing how powerful it is. It's something we're also doing in the learning and leadership development space. But I think creating wisdom, knowledge, contact points in the community that you're serving is a really, really powerful thing. So we've been training mental health champions. We piloted that approach in a few countries. We're now scaling it. I've been absolutely amazed and grateful at people's willingness to be trained, to go through that training. We now have almost 2,000 mental health champions trained and ready across many different countries and cultures. And that's a really important thing. The other thing we've been trying to do is during the course of last year, when we were tracking data on wellbeing during the pandemic, we also noticed that there were particular groups whose mental health was particularly challenged. And we tried to then train mental health champions in those groups, for example, amongst our younger employees who have particularly found this pandemic stressful and anxiety creating. So I think that's another way you can use mental health champions. Mindfulness champions also is, I think, has been a great revelation. We're currently in a kind of movement to train more. We have mindfulness champions trained in many different languages across time zones who run sessions repeatedly. And it's a very powerful way, again, of giving people techniques and awareness that helps them to manage their mental health. This is an example I said I'd give you of a line manager check-in on well-being, which again doesn't cost any money to do, but and even to create, to train into line managers, because it's very, very powerful. We've been training in and encouraging our line managers to do check-ins throughout this pandemic, and in fact beforehand. We've put it really at the heart of the approach to leadership that we're building. We're talking a lot at the moment about high support, high challenge as the way that we need our leaders to lead, to help the organization have high performance, which we need, but in very turbulent times. And a key part of high support is for leaders to have techniques like this, the ability to very easily start a conversation with the team about how they're doing. And to also have, it also gives a chance for the leader to share how they're doing. And that creates a psychological safety, which is hugely powerful. A psychological safety, which is really powerful for mental health, but hugely powerful for performance, for creativity, and for innovation. One of the things that I've found over the years of working on mental health is that actually what's good for the organization's mental health is good for its performance. These things are not in conflict. And they're actually, as we work on mental health, we are both doing the right thing for our people, for our purpose, and for our performance. So what kinds of things have we learned from our journey? So we're a big global organization, and many of you will be in similar, but many of you may also be in different kinds of organizations. But one of our lessons being in a global organization is that global enablement through a common language for well-being and for mental health and for our action plan, that really helps. Providing global tools like, for example, the team energy assessment, those are the things best done globally. But actually, local activation is absolutely critical. Having local leaders, general managers of our business, for example, and our HR leaders really actively leading for this is critical. Global programs does not substitute for local activation. Local activation is best enabled by global tools and programs. Leadership buy-in is an absolute requirement to begin with. You need your senior leaders to buy in. But actually, as things go forward, you need to progress from buy-in to active engagement, because that really accelerates progress. And I think, so there's a journey here. Sometimes senior leaders, I think, of businesses and organizations that I've spoken to start by accepting the need and that something has to be done. And over time, they realize the power and importance of it and they become involved. I think that's an okay journey to go on. The power of a community can propel the agenda like never before. So we, very early on in our wellbeing journey, we wrote a workshop called Thrive, which we trained internal facilitators in our community to run. That created the basis of a group of motivated wellbeing champions that we've built on and built on. And then we add the mental health champions to that and our mindfulness champions. That community in the organization really takes the agenda forward, and it is creative of insight, creative of new ways of doing things, and creative of insights from the different cultures around our business. And lastly, building psychological safety and storytelling are critical. Let me take those in two parts. So building psychological safety is, I think, fundamental to what organizations need to do right now. I think this comes through in all the work on leadership, on innovation, on creativity, on agile, on and of course on mental health. And thinking through how you're going to have a strategy for building psychological safety in the organization is key. And joining up with all the other people that can help. So almost by accident, I'm a chief learning officer and responsible for employee wellbeing. But actually, it's been hugely powerful to be able to bring these things close together. We're responsible in my learning team for equipping our people with a sense of their own purpose, an opportunity to explore their purpose. Purposefulness is also extremely important to mental and emotional health. Psychological safety matters to leadership, except you see the joining up. So working with different groups across the organization on some of these key enablers like psychological safety. And then lastly, and Rob talked about this too, storytelling is a critical ingredient. I found this from my own experience. I discovered on my journey of working on mental health that actually there was a name for some of the symptoms that I was experiencing. I almost died in an accident in my 20s, and it had left me with post-traumatic stress, but I didn't know it was called that. I thought I was just a funny person and that I had these difficulties to face. Discovering that it had a name meant that I could also go and get help. And I got help, and I've had quite a lot of help since. And I also told my story a few years ago. And I was really amazed by what Rob said, because exactly the same words I've used. It's helped my leadership to be far more authentic. It's helped me as a human being to be open about it, but it's also helped other people. The number of times I sit in a meeting or a conference, a leadership development session, I tell my story and somebody, usually a man, follows me out and says, "Can I just talk to you?" Storytelling is massively powerful. We've done a lot of it. You have to do it well and you have to do it responsibly. You've got to support the people telling their story, because it isn't easy. It does take courage, and it is uncomfortable, but it is also very powerful. So I'm going to stop at that point. I would just leave you with a final thought. As I said earlier, COVID is a huge challenge on the world's mental health. It is bringing an epidemic of poor mental health alongside in its wake. It also provides a critical moment on mental health. If, as we manage moving in and out of workplaces, supporting people who remain in workplaces, if we can use that as a moment to make it okay to talk about mental health and for leaders to be equipped to have that conversation, we can unstigmatize mental health for a generation to come. If we get that wrong, if we don't meet that moment and people feel they can't share the mental health implications of what's happening to them, we will stigmatize mental health for a generation. So I'm so encouraged that we're on this call together, having this conversation. We're really committed to the Global Business Coalition for Better Workplace Mental Health, and I will leave it there.
Many thanks, Tim and Rob. And Rob, if you can come back onto camera, that would be fantastic. They were absolutely fantastic presentations and reflective, given all the comments we've had in the chat actually, and absolutely loads of questions, which is brilliant. So I'm going to start trying to group some of the themes, and we can sort of work through them. There were some very specific questions which we may need to take offline, but let's go for some of the bigger themes first. And I think one of the first ones was around obviously COVID, and how obviously you've been building these action plans for many years, but actually COVID has changed our world. It's meant that we've had to adapt to home working. It's meant that actually we're now thinking about how we bring people back into the office. And we had some particular questions around how things like EAP being sort of changed or adapted to support that. And also, how have you sort of geared up resilience training? And I know that, Tim, you've spoken a little bit about that, but it would be great to hear from both of you your sort of initial reflections around how has your action plan changed because of COVID, and what have you found to work really well? Tim, or Rob, should we go over to you first?
Yeah, look, I mean, obviously COVID has had an enormous impact on our communities, our business, and it's been a very strong focus, both in terms of keeping our people safe during the pandemic, but also supporting their mental health. I guess, very early on, there was just sort of so much noise and so much information and misinformation. We were fortunate to be very sort of tapped into some of the global experts from a pandemic perspective. And we simply held, regular global town halls with myself, the CEO, or other sort of senior members. First of all, sort of providing, I guess, sort of some context and trying to provide, a degree of accuracy, as well as, looking to the future in terms of what we could expect. But at the same time, being vulnerable and being authentic in terms of the impact it was having on ourselves, and making it kind of okay to feel a bit of distress, to feel anxious, to have good and bad days with everything that was going on. So again, it was sort of normalizing the experience and the mental distress that comes with such a thing as a pandemic was, I think, really, really important, giving people the opportunity to then voice their concerns and what was occurring. Very early on, we recognised that we needed to double down on resources, and we, working with our EAP, we basically committed to double the funding for EAP, recognising this is going to be so critically important, and started running a lot more sort of online modules. We still had obviously operations with people going to work. It was really, really important they felt safe and that their family members felt they were safe going to work. And so, we did everything we could in terms of our COVID protection program and communicated that widely. We also enabled people with high risk for COVID serious illness and death to not come to work and continue to pay them. And so again, that sort of just demonstrated our commitment and provided some confidence in terms of what we were doing. And finally, we sort of changed a whole lot of resources for our leaders, particularly leaders who are now managing remote teams and working from home. You know, what were the skills that they needed to be more effective in leading their people, to be, to equipping them with the technology and the ability to work with the skills available to them and tools available to them, and supporting them as well. So probably a lot more, but I'll stop there and see what Tim's got to add.
Yeah, so a lot of the same, I have to say. So let me try and say some different things. And I'm also noticing something in the chat about situational mental distress and chronic mental health. I think one of the things that we've been doing in the pandemic is to try and broaden people's understanding of what kinds of mental ill health people experience. So I talked about post-traumatic stress, what the impact of grief and bereavement is, and to help people spot the signs for that, and also to know that there is treatment. I think one of the things that I think can happen is that people don't realize how much, I mean, there are over 100 talking therapies alone that are available, so helping people understand that there's help available. So giving people a lot of information through films, through written literature, a lot of communication. I think our CEO's been talking to the company every 2 weeks since the pandemic began. We've covered mental health in there repeatedly. Not just in World Mental Health Day, but throughout the course of it, repeated signposting to where the help is, a lot of line management training. So as I said, kind of using these critical moments of returning to workplace, you've got to seize those moments. So a lot, I mean, I think, and maybe this last thing, we ran in the middle of last year, over the Northern Hemisphere summer last year, a number of sprints with people in the squads from around the business, looking at particular needs. What was going to happen in hybrid working? How could we look after people's mental health in hybrid working? How could we protect those at high risk? So, for example, how could we deal with giving people the chance to lose weight? Because it was becoming clear last year that obesity was a risk factor. You know, how could we help people who wanted to lose weight, to stop smoking, those kinds of things? So those sprints were actually brilliant in getting more people involved in the creation, identification of needs and programs. And that, of course, every time you do that, increases your movement of people who get this and are passionate about it.
Lovely. Thank you very much, Tim and Rob. That was great. Another theme that is coming through is this idea about sort of supporting the individual, and then also how the organisation transitions to support a more sort of mentally healthy workplace. And I think, Rob, particularly you talked about the importance of prevention, and actually if you've rewound right back and sort of prioritised perhaps one or two things that came later, it would be that identification of psychosocial risks. I think it'd be quite interesting to hear a little bit more about what you see that as in the workplace, and really thinking about this sort of difficult balance that a lot of businesses face with performance and burnout, and particularly with the sort of COVID situation, sort of blending that, or that inability to sort of separate your desk from your home life. But it'd be great to hear perhaps a little bit more about what you'd found, Rob, and then perhaps we can pass it over to Tim as well about sort of prevention approaches.
Thank you. So just to revisit it, I mean, good work is good for health, and it is both sort of protective of those coming to the workplace with a mental illness, as well as stopping the potential sort of onset of mental health conditions. And there's some suggestion that that maybe only the workplace might be responsible for 15% of the burden of total mental illness. So we're certainly not saying that mental health is the predominant cause of mental illness in society, but it's a contributor. But equally important, or possibly more important, is its protective value, which is why we think that the focus on good work is just so important. I mean, there's a number of models out there to look at to identify what those psychosocial risks are, and the UK HSC has got a very good model with sort of five domains there. But essentially, you think about the work environment, you think about the design of good work. You think about putting the right worker in the right role. It's about good leadership. It's about development opportunity. It's about inclusion. It's about psychological safety, as Tim indicated. And I guess, you know, we've got programs in place to support and address and meet all of those elements. But where we need to get to is probably more effective at identifying those hotspots within the organisation where potentially those risks are playing out in a different manner or might be at greater risk, and we need to put in some more targeted interventions to support the leaders and to support those teams. Look, there's a couple of ways that we're looking at doing it through our engagement and perception survey. I think that's sort of as a starting point to get an idea in terms of how engaged and how enabled people are feeling. But that's only a starting point. You then need to be going on and doing some deeper dives in terms of getting into those work groups, including sort of observations, potentially doing some workplace surveys, and trying to get a bit of a sense as to what actually is the heart of the problem. And then it's about going through, equipping your leaders, looking at sort of the changes required and putting in place those programs, going back and measuring for the impact. So look, as I said, it's something which we're doing, but we need to be more systematic. We need to be a bit more focused and get some better monitoring and evaluation in that area. I'd hope in sort of 6 to 12 months' time, I'll be able to come back, Rebecca, and give you a little bit more of a fuller response to that question.
Amazing, thank you. And Tim, over to you. How have you been trying to sort of evolve it into a more sort of preventative approach?
Yeah, so I think this is where you get into how workplaces, and I think we discovered this very vividly last year, that as we were running different work streams in our HR leadership team, inspired by the kind of virus situation, we suddenly realized they were all converging in a certain space. So workplaces, future of workplaces, how do we make that work? How do we help people return? They were focusing a lot on line managers and teams and how line managers and teams work together. How do they agree how they're going to work together? There was a lot as we got through Agile and thinking through how we were going to enable Agile in this environment. And we were thinking about how do we enable good leadership for good mental health and well-being. And we realized we were all heading to the same place. So we built some tools that do all of those things. So the key point, again, which I made during the presentation, is you have, if you want to get really into prevention, you are creating a good, healthy workplace, and you have to pull on all the levers of that, on line management, on teamwork, and then on organizational measurement. How are you measuring the kind of the workplace? How are you measuring, how people are working, when they're working? How are you using that data responsibly? How are you understanding people's mood, their energy levels? And how do you bring those different data sets together? So I would say the secret of prevention is a healthy workplace, but then you're into such a magnificent business case, because we know that organizational culture accounts for more than 50% of financial performance. We know from the multiple research studies that there are certain types of culture which drive growth. Those healthy cultures are also healthy for human beings. So I think this is bringing these different aspects together in prevention allows you to build a coalition of people with a similar goal. And again, it helps to accelerate the agenda on progress on mental health.
Brilliant, thank you very much. I'm going to move quickly on to another theme that's come through, and one that we've discussed as a collaboration a lot, which is around the topic of measurement. So we've obviously touched on some of the sort of user data that we measure in terms of interventions. But I think what the audience were looking at were really what other ways perhaps you're measuring success, and also thinking about some advice if you're starting off in that measurement journey. Where do you start, and what sort of low resource, I suppose, where do you start and sort of build up from?
If I have a pop at that first, this is a really hard one, isn't it? This is a really hard one. And honestly, I think it varies a bit depending on what your situation is. So when I started really getting very involved in mental health at work, I was working in Unilever's UK business. And we built scorecards very quickly because we had UK data to work on. We knew our sickness absence level, we knew our long-term sick, we had our private medical insurance data. And we were able to build scorecards. As soon as you go global, most of those data sets don't exist on a global level, and you start to struggle. So I would say start off with what you can get in the environment you're in. So if you're in an organization in a country, you'll just start gathering together the data you already have: absence, etc., sickness, long-term sick. If you've got private medical insurance, the data you get from that, and it starts to help you just to get a sense of what's going on. I don't think it's very complex to do. It's very complex if you start automating it, but just running a dashboard, relatively simple. Then I think if you're in a global situation, it's much harder, because getting some countries' legislation on this, of course, is also extraordinarily tough. Getting comparable data is very tough. What we do at the global level is we do a lot of attitude surveying. We do a lot of work with our HR analytics team, looking at the data that they already have around the organization. And particularly since a lot of our office workers went entirely digital onto Teams, we've been able to get decent analytics data on what's actually happening to people and what are they doing in their working patterns. So I think there's that kind of data is available. And then the ask is how you bring it together. So to summarize, we measure programs, we measure people using them, we measure the impact they report from using them, we measure the health of the organization, and we try and correlate some of those data sets together.
Brilliant, thank you. Rob?
To be honest, I don't think I've got much to add upon that. I mean, it's a similar approach. I could, repeat on those elements. Nothing more to add to that one. So perhaps an opportunity to ask one more question.
Fabulous. So we have also had a few questions coming through about sort of globally enabled, localized, sort of led strategies. And an interesting point, Tim, that you were making about the rules and regulations and how that can actually sort of shape and shift your approach. But another interesting question that's just come in as well has been this sort of difference between a globalized strategy sort of dropping down and then being perhaps molded, as opposed to actually just leaving local teams to build from the ground up and sort of take into consideration those cultural contexts and realities. And in your experience, have you tested much of this out, and have you found any sort of way that worked better than the other way? Or what would you sort of suggest if someone's trying to sort of roll out workplace mental health strategies and have done quite a lot perhaps in one country but need to shift it to another?
So look, I think I've seen Aruna's comment in the chat as well about the global south, and I think it's an absolutely correct point. But you've also got to begin from where you are. So if your assets come from country A and you don't have the resources to rebuild them, I think getting people from all your other countries to look at them and adapting them is absolutely the right place to start. You have to be pragmatic here. The most important thing is we get going everywhere, and we really make workplaces across the world mentally healthy places to be. So, but you do have to be constantly aware that, exactly as has been said, the nature of stigma varies. The nature of the cultural context varies. And so you do have to give space for people to take tools if you're going to create them globally and to give them a local context. I think the best thing is we have, and the team, I think, have done a magnificent job doing it, is building a global network of people who are from the beginning involved in the building of tools. So our little wellbeing team in itself includes people from 3-4 different countries. So I think, and then you have the movement beyond them. So making sure the people creating the strategy, creating the tools are globally informed, and that people really have, there's lots of points of view, and giving space as far as you can in countries to adapt. And of course, give them space if there's something particular they need to build what they need.
Brilliant. Rob, anything to add?
Look, yes, I agree with everything that Tim has said, and you need to absolutely understand what is going to work and what's important for for that local context. So for us, Movember has been a really big campaign, and it started off in Australia. You grow your moustache, and everyone has a bit of fun. We decided to make that a global campaign, and sort of thought it would just happen. In Chile, it really wasn't that successful. There were a couple of barriers to it over there, and we just weren't gaining any traction. What we soon sort of discovered was that Chile they're quite a physical sort of a culture. They're quite energetic. They're passionate about their sports. And so actually through our partnership with Movember, we look to explore how might be some ways that we could expand this campaign. And through some of those conversations, the Move initiative addition to Movember came where you could grow a moustache or you could move. Moving was something that resonated with folks in Chile, and they took it up, and that became, for a while, for the first year or two, it was more about the physical side of it and not the mental health side of it. But now we've managed to bring the two together, that they're moving and they know that moving is important for mental health. And so I guess it's looking to adapt and to learn and to take in that local context with those global programs.
Brilliant, thank you. We're at time actually, but I just wanted to sort of finish on one last question, and I guess keeping it short and snappy. We've had a few questions through around how you sort of get leadership buy-in, how you get, particularly if you're thinking about right at the beginning of a journey and you're having those first conversations with leaders and organisations. Can I get you both to do a little bit of an elevator pitch just around what are those sort of key messages that you'd be trying to get across to leaders of organisations so that they prioritise this issue? Tim, I shall pivot to you first, if that's okay. Put you on spot.
High-performing organisations need high-performing people. Given that, name the statistic, 1 in 4 of us at any given time, maybe more now, are experiencing mental ill health or family members are, we have to focus on mental health as a key component of our strategy to be high performing.
Brilliant. Thanks, Tim. Over to you, Rob.
Everything that Tim said, and the context now is COVID-19, the additional uncertainty, the complexity, the stress it's putting on our individuals and their families means that supporting their mental health has never been more important.
Fabulous. Thank you very much. Well, look, thank you so much, Tim and Rob, for taking the time to share with us your action plans for workplace mental health and for fielding all those questions. We certainly haven't covered them all, but what we'll do is we'll definitely take a note of them and we'll try to follow up separately with some of the more specifics. The one thing I would say is where attendees have got into more of the granular detail around programs and approaches, such as how mental health advocates and champions are used in the workplace, we will come back to those in our further webinars amongst the different sort of pledge areas. So please do keep an eye out for those, and we can get more into that granular detail as well. We will also make a recording available to you all. We'll email that out to you so you can share that with colleagues. You can post it on your social. It's a piece of content that we want to make sure is viewed by lots of people. And yes, thanks again to our speakers today. It's been an absolutely fantastic session and reflective of the comments that I'm seeing in the chat. So thank you, and yeah, we'll speak again soon, hopefully.
Thanks very much.
Okay.
Thanks.
Thank you, Rebecca. Thanks.
Bye, everyone.